the last video I did on disc healing and the study I was describing there. And the big thing about disc herniation healing is the importance of metabolic health and the importance of things like microvascularization, so reperfusion of the injured area, um, getting the system mobilized to send in the cleanup crew. And the paradox of it all is kind of that the larger the disc herniation and the more um, material from the nucleus that has escaped the disc, the the more that the body's going to fix it, or the higher likelihood that the body's going to have a full cleanup. And the issue with that, though, is the kind of the general health of the person. And these are things that if you're a clinician, you've probably noticed over the years, the more people you've worked with. But the problem we run into is when we see folks with disc herniations, um, and they just kind of have general poor health in a lot of ways, is they're just given medications, offered injections, surgeries, things like that. When if we could, this is a, a failure of kind of the entire system and how things go when something like this happens to a person. But and lifestyle habits and things of the person that has been injured. But when if we really wanted folks who come to us with pain relating to a disc injury, getting them on the path of some sort of formal, tolerable exercise and getting them to commit to changes in some basic lifestyle changes. If there's somebody who smokes, they need to start getting that under control. If there's somebody who consumes lots of alcohol, they need to get that under control. They need to get their sleep under control. But the main thing, and this is why basically like any exercise, starting like any sort of exercise helps improve outcomes with back pain, particularly when it's related to injuries to a disc, is you're making that effort to improve the physiologic and metabolic environment of the system. So it's the exercise itself doesn't really have to be that specific, and that's where people get hung up. They want to do this method or that method or work on people's core stability or whatever it is. But I can probably make great progress with you on getting the body to improve the healing of the tissues of the disc injury by having you do echo bike work or learn to do some rowing or walk at an incline and get your heart rate up. Just doing anything we can that you can tolerate to start improving the metabolic environment of the whole system. So when this is where most people get failed when it comes to you're trying to treat these things, is they get stuck in this medicalization of the problem, and they're really only offered solutions that require medications, procedures, things like that. And even if they go into something like physical therapy, chiropractic, or anything like that, the likelihood of them being stressed physiologically is low. They're going to be put on some very low level exercises that don't progress very well. They're probably not going to have their cardiorespiratory system stressed to help improve their body's just basic physiology. So we have to make sure that we're helping our patients, people that come to us with these situations, just understand that they have these symptoms now, the problems there, understand that these kinds of injuries to discs heal over time, but to set up the best possible outcome and environment for healing, we have to start with lifestyle. We have to start with improving the overall health of the system. And that's the most difficult part. It's easy to say, take these meds. It's easy to say, I think we have an injection for that. It's hard to get a person to really understand that getting better is in their hands, and we have to get started with something that they can tolerate. So hopefully that makes sense and helps. Look back and check out every other video I've ever done on these things on my channel. See you next time.